January 25th, 2011 meeting of the Human Services will now come to order. Clerk, will you please call the roll?
Miss Andrews. Here. Mr. Daniele. Here. Miss Cayley. Mr. Lightfoot is excused. Dr. Quattro. Here. Mr. Rocco. Here. Chairwoman Draw.
Here. Is there anyone signed up for public forum this evening?
There are no public forum speakers tonight.
And is there anyone present here that would like to speak to address the committee at this time? Seeing none, the next item on the agenda is the approval of minutes. You have before you the January 4th, 2011 minutes. They will stand approved unless the clerk is notified by any changes by the end of today. Next item on the agenda is new business. Madam Clerk.
Referral 11-18 authorized.
Moved by Legislator Rocco, second by Legislator Quattro. Any discussion? Seeing none, all those in favor signify by saying aye. Aye. Any opposed? Item carries. Next item.
Referral 11-19 authorize a contract.
Moved by Legislator Quattro, second by Legislator Daniele. Any discussion? Legislator Cayley.
My hand's higher. Thank you, Madam Chair. Just one question on this. Was there any other respondents to the RFP other than, or was there an RFP other than e-medical?
RFP, there were 3 respondents, and this was the far and away the best proposal.
Thank you. And then a follow-up to that through the chair. Are all 3 then have been in this business lengthy enough time to qualify for what you need done? Sorry, that was kind of awkwardly put. How long have they been in business? Through the chair.
Through you, Madam Chair, I don't know that particular statistic, but these are companies that are doing business in the community and are well known to us. There are a number of vendors that there are a lot of physicians in the community that are buying electronic medical records now. So there's a lot of business going on.
Thank you. That's really what I was getting at. I just was awkward the way I asked it. Thank you.
Any other discussion? Legislator Andrews.
Thank you, Madam Chair. And through you to Dr. Doniger, were any of the 3 responders to this RFP located in Monroe County?
I don't believe I have that information with me, and my recollection is that all of them are outside of the county. But I will check that and get back to you about that.
Great, thank you. Through the chair, I don't recall a similar referral in the past regarding the electronic medical records, although I am aware that it is sort of the direction that we're going in and supposed to be a good development for healthcare. Can you talk a little bit about what your expectation is for eClinical Works and what we hope this will help us do?
Through you, Madam Chair, there are a number of ways that we believe that this will help us. We believe that it will improve the quality of services. We hope to be able to get information out of our electronic medical record that will help us do quality assurance better. Just as an example, with our current paper system, it's very hard to find all of the children that have diabetes, or all of the children that have another condition for which we may want to provide some special services. And we may want to monitor the quality of care that we're providing to those children. So this gives us a tool for quality assurance. It also allows us to do electronic prescribing, which is a way to reduce errors associated with prescribing. Notoriously, prescriptions result in errors, and through electronic prescribing, errors are minimized. Also, electronic prescribing is a way to reduce the cost of our care. The first time we perform an e-prescription, it is a little extra work, but then when the time for the refill comes, it's just a matter of going into the electronic medical record and basically making a couple of clicks of the mouse, and a message is sent to the pharmacy to refill the prescription. And it's quite a time saving, both for the family that is receiving the prescription, but also for the provider. So quality and cost, those are a couple of examples of how we hope to use the system.
Thank you very much. And this referral with eClinicalWorks is specifically for the new Monroe County Pediatrics and Visitation Center, the Starlight Pediatric Clinic that's open, that I'm very excited to see is complete and is running. Is there any expectation that perhaps we would use eClinicalWorks or some other provider to do electronic medical records for MCH at some point in the future?
Through you, Madam Chair, which MCH are you referring to? The Monroe Community Hospital?
Yes.
Through you, Madam Chair, I don't believe so. eClinicalWorks has really been designed for outpatient primary care, and I don't believe that it has a module or it has any utilization or functionality regarding nursing home care.
Okay, thank you very much.
Any other discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item, Madam Clerk.
Referral 11-20,
Moved
acceptance.
by Legislator Daniele, second by Legislator Rocco. Any discussion on this? Legislator Andrews?
Madam Chair, through you to the administration, I'm obviously pleased to see this referral come through with some funding for the Nurse Family Partnership Program, and it indicates that we expect to provide visits to about 62 families as a result of receiving this funding. Can you tell me again what the number of families that we anticipate serving for this year is, please?
Through you, Madam Chair, with the funding that we have in the budget for this year and the grants, including this grant, we believe that we have resources available to provide services to 275 families. We are not at that number right now, and we need to build, and it takes a while to do that. So we're hopeful to be at 275 somewhere during the year this year. We do have the hope that we may get some, start billing for Medicaid soon, and our hope would be that once we identify exactly the revenue that we will actually be able to get in on an ongoing basis from Medicaid, that we may be able to expand that number. But we don't really know exactly how much we can expand the program, and so we're reluctant to make a specific projection at this point.
Thank you very much. And I think I recall from a previous meeting that perhaps you mentioned one of the issues in growing this program was actually the nurses that are needed for it. And I don't want to put words in your mouth, but is that true that that was one of the issues, and is finding and retaining nurses for the visiting nurse component? And if so, how are we doing in that area?
Through you, Madam Chair, you might recall that the way that this program is set up is that the nurses are hired through the visiting nurse service. They are actively recruiting all the time. Unfortunately, we're still, to some extent, in a national and a local nursing shortage. A couple of times during the past few years, when we've had some turnover that happens naturally as people come in and out of the workforce, we have found it difficult to recruit new nurses. We're at a point now where we have all the nurses that we're funded for, but we do anticipate that there may be some delays as we recruit more nurses. And we've been talking to the visiting nurse service about kind of thinking about this, trying to identify who some nurses that they might have that already work for them, or what they might be doing for recruitment if we do call them and tell them we're ready to push the number up. but we do anticipate that there may be some difficulties with this.
Great. Well, I wish you the best of luck with that, certainly, and certainly support the growth of this program. So thank you.
Any other discussion? Seeing none, all those in favor signify by saying aye. Any opposed? Item carries. Is there any other matters to come before this committee? Legislator Andrews.
Thank you, Madam Chair. And if you would just permit me just to follow up regarding the article that was in this morning's Democrat and Chronicle regarding child care subsidies. If you don't mind, just a question, really. I noticed Commissioner Reed is here. The morning paper reported that more than 700 families so far had been turned away from the child care subsidies due to the cease in enrollment as a result of changes in funding levels last year. I know we touched on this briefly during the budget cycle, but I don't think at that point in time you had the information available. Can you nail down that figure a little bit and explain to me if you see that if you anticipate that figure growing throughout the year, or is 700 accurate? And do we have any sort of outreach with those families that are being declined the child care services?
Through you, Madam Chair, as of, and I hate to misquote the date, but I believe it was January 14th, there had been 712 families who have applied for the low-income subsidy that had an application denied up front. Since that time, the number has grown. However, the rate of growth has slowed down quite a bit. It is, knowledge has spread throughout the community pretty thoroughly that no new subsidy cases are being established. Therefore, the number of applications that come to us on a weekly basis has really dropped off over the past month or so. The last time I talked to the team supervisor, which was last Wednesday afternoon, we were receiving perhaps only 25 or 30 applications a week. Quite a drop from late October, early November. Right now, there is no official mechanism to do any outreach to families in the community. We monitor the subsidy program on a monthly basis. Our statistical files are produced on the 5th of the month, and those are reviewed. It takes about a day or so to pour through all those and update our projections. And we share our projected information with the ECDI, the Early Childhood Development Initiative, and our funding partners at Children's Institute.
Thank you very much, Mr. Franklin. I didn't see you through the plant sitting there, but I appreciate the information.
I try to hide.
Is it your expectation at this point in time that we'll be able to keep the eligibility level the same level throughout the entire 2011 year?
Madam Chairwoman, yes, we do anticipate that the eligibility threshold will remain at 165% of the federal poverty level. Adjusting that threshold is an option we've applied in the past, and it is much more palatable to us and our community partners to instead employ a method whereby we process upfront application denials, because that simply prevents new families from coming on the system rather than forcing existing families off.
Okay. Thank you very much for that.
Thank you, Mr. Franklin. Any other discussion or questions? Seeing none, there's the January 25th, 2011 meeting of the Human Services Committee stands adjourned. The next meeting will be February 15th at 6 p.m. right here. Thank you.